they are rubbing on the surface of the cornea. So this is called as an entropion. This is an entropion. What is an entropion? Entropion means an inward turning of the lid margin. So see here the lower lid margin has been turned inward. So this is an inward turning of the lid margin or entropion. Now, what's the opposite of this? The opposite of this is this image. So look at this image and tell me what is it. Here, if you look at the lower lid, see this lower lid is actually turned outwards. The lower lid is actually turned outwards. So what will we call this? This is called as your ectropion. Correct. Good. This is called as an ectropion. And what is ectropion? Ectropion means outward turning of the lid margin. This is called as outward turning of the lid margin. So entropion, inward turning of lid margin, and this is the ectropion or outward turning of lid margin. Now I am going to show you this image, which is a tough image. I want you to look at this image and tell me what is the diagnosis, and then I'll help you with it. I'll help you by saying that look at these three images. The first image is an image of the primary position. Primary position means this is the image when the patient has been asked to look straight. The second image is when the patient has been asked to look to the right side. So this is in the right gaze. And this is when the patient has been asked to look to the left side. That is the left gaze. So see, look at this image. This is the right eye and this is the left eye. Many of you have actually guessed the right answer. So if you look at the left eye, so you can make out that this left eye is showing a convergent squint, right? It is moving, it is deviated inwards. So this left eye, this has an esotropia. Esotropia means what? Esotropia or convergent squint. The left eye has an esotropia or convergent squint. Now, if you look at the right gaze, see the right gaze is normal. But if you look at the left gaze, you will see that there is no abduction in the left eye. So there is loss of abduction in the left eye. Right? So in the left eye, there is an esotropia and also there is a loss of abduction. See, this left eye should have actually moved to the corner. It should have abducted, but it is not abducted here. So there is esotropia in the left eye and there is no abduction in the left eye. So this is a case of left-sided lateral rectus palsy, or we can say it is pupil in the left eye. Try looking at the pupil in the left eye. What do you see about the pupil in the left eye? The pupil in the left eye is dilated. So there is a severe ptosis in the left eye. The eye is deviated downwards and outwards, and the pupil in the left eye is dilated. So all this together, it gives us a diagnosis of left-sided third cranial nerve palsy. Left-sided third nerve palsy. Right? So this is giving us a diagnosis of left-sided third cranial